Welcome back. This is our second part, or part two, for the dental and diagnostics, emergency medical technicians, things like that, PowerPoint. So there are only a few more slides, but I didn't have enough time on the other recording. So our next career, health information and communication services. So health information is medical records, anything involving your medical records at a hospital, a doctor's office, or whatever. That's usually the health information department, health information management, things like that. But it's called medical records, health information management. So medical records administrator, you're thinking, gosh, why do you have to have somebody, to administer over our medical records? Medical records are a big deal. We talked about HIPAA before, and HIPAA is an act that ensures privacy. Our patients deserve privacy. They need to know that when they come and see that doctor or that nurse or that dentist or whoever, psychiatrist, that their information is going to be held in confidence, those people in the office are not going to go out and tell their business. So HIPAA is a big thing in healthcare, okay? All patients deserve privacy. So, with that being said, medical records, there are a lot of laws regarding our medical records. You just can't walk in and say, "Hey, I want my records," and get them, or say, "Hey, send my records to so and so." And doctors can't say, "Oh, I'm sending that patient to a cardiologist. I'm just going to send those records." So you and your doctor are in charge together of those medical records. So there's actually someone, typically in hospitals or in large facilities, that is over the legalities of health information and sharing that patient's health information with other people, okay? They're making sure that that facility is compliant and that they're not breaking any of those HIPAA laws. So when we talk about a medical transcriptionist, this is not something that's done a whole lot anymore because healthcare has electronic medical charting at most places. But the medical transcriptionist, what her job was, when you see on TV or whatever, you see a doctor that's sitting down at a desk, he's got a phone in his hand, and he's dictating or he's talking into this phone. It's like he's recording what he is doing or what he done in surgery, like he's recording a surgical note. Or an operative note. He's telling every single step that was done in that surgery, so there's a record of it. And what that medical transcriptionist would do is once that doctor has recorded what he or she done, that transcriptionist would listen to that recording and they would type what that doctor said. Okay, so that's what that medical transcriptionist done. She just typed up, or he typed up reports of what their doctor had recorded. Now, we don't use that a lot anymore, as I said, because of electronic medical records. And once that doctor gets on the computer, he actually can chart his own information in that patient's chart of exactly what he did. Okay, so we still have those around some, but they're not as prevalent as they used to be. Now, a unit secretary. That unit secretary, we think of at a hospital. The unit secretary, once you go, walk up to a medical unit at the hospital, that unit secretary is that first person that you meet, typically a lady. The first person that you see there, she's answering the phone, she's answering the patient call lights when they call and need something. So she's kind of running the paperwork aspect of that, answering phones, getting lab reports, putting things in charts, things like that. Okay. And she is a very important person up there because she probably knows a lot more than anybody else because she's talking to everybody. Okay. So now next, medical illustrators. That is just what it says, a medical illustrator. They are artists that actually work in the field of medicine. They're the ones that draw the pictures in your medical books and your nursing books. They draw them with such accuracy that when you see it, you know what it is. Like, even if you're looking at a book and you're doing, you want to know the different chambers of the heart. Once you go into a surgical residency and you're doing surgery on cadavers, which is, a dead body just for practice, you can actually see that, and you know what that anatomy is like because there was such an accurate picture that has been drawn. So that's what those medical illustrators do. They, create things for you to help you learn. So when you see them, you'll learn from them. They can also be on TVs. They can do exhibits for court cases, things like that. So it's just what they are. It's just an artist that does medical artwork. And this is going back over that again. They do illustrations in medical books, textbooks, all kinds of stuff. So that's about it for the medical illustrators. And that's it for this PowerPoint. Thank you.